Hi, I'm Dr. Peter Ameglio. I'm an orthopedic surgeon in Fort Myers, Florida. I'm coming to you from Ameglio Orthopedics. I'm going to talk to you about SI joint dysfunction, an often overlooked cause of low back pain. When a patient presents to me with low back pain, if they have pain above the belt line, I consider it a lumbar, spine, or low back pain. If it's below the belt line, I think about the sacroiliac joint. Patients that have this dysfunction or this type of pain frequently will point directly to it. And that gives me a good clue that this could be a sacroiliac joint dysfunction. Things that cause sacroiliac joint dysfunction: arthritis. It can become arthritic like any other joint, like the hip or the knee. The SI joint is the great imitator. It really can fool a surgeon or a medical doctor as to what the cause is, because hip arthritis can present like SI joint dysfunction, low back pain. There are a lot of different things. So the physician first has to be alert to that. Patients can have pain in the back, they can have pain in the lateral thigh, they can have pain in the groin. The pain can radiate all the way down to the foot. Common complaints the patients present with sacroiliac joint dysfunction. Before I even enter the room, I may see the patient leaning to one side because that right sacroiliac joint hurts. So that's one. They can't sit comfortably. They have difficulty sleeping and getting through the night because they can't sleep onto that side because that hurts. Getting out of the chair will hurt. The interesting thing is, if we don't think about it, we never see it. And we think it's not prevalent or it doesn't exist. Patients would have a condition that maybe 10 years of back pain, unresolved, and when you think about it, you look for it, then you find it and you're able to treat it and relieve that pain. And that's now become my mission. It's very rewarding for me. The ultimate diagnostic test in my hands is to inject the joint under X-ray guidance. If that pain goes away, and frequently it may be complete pain relief within 5 to 15 minutes. If that happens, then we know that's a diagnostic test for sacroiliitis or sacroiliac joint dysfunction. How do we treat sacroiliac joint dysfunction? The sacroiliac joint, as we mentioned at the beginning, is supported by ligaments and muscles. So we can do physical therapy to strengthen those muscles that support the spine and support the pelvis. If you develop pain that begins to adversely affect the quality of your life, then we'd start to consider either radio frequency ablation, sometimes called RFA, or an iFuse minimally invasive sacroiliac joint fusion. It's through a small incision, perhaps 2 inches long, on the side of the buttock. With X-ray guidance, we can actually put triangular titanium implants across the SI joint and stabilize it. As a surgeon, deciding to do a particular surgical procedure really depends on the clinical data. I really care about my patients, I want them to do well, and the clinical data supports the use of this implant. But one thing is reading an article or reading 80+ articles that are published, and one thing is actually having your own patient, doing the procedure on them. When I see them come back and see that they've really had a good outcome, that really reinforces my desire to continue to take care of them. So if you think you have any of these symptoms that I've discussed in the low back, below the belt line, lateral thigh, groin, radiating down the leg, nobody's been able to tell you why you hurt for years, please come see me. I'll be very happy to help you.